Good afternoon. Thank you for joining us today for the Basics of Medicare Benefits. My name is Ashley Haas. I'm the Director for Consumer Information at Benjamin Rose Institute on Aging. This session today is being offered as part of the Administration for Community Living Alzheimer's Disease Programs Initiative project, expansion of dementia-capable communities within urban and rural settings in Ohio using evidence-based and informed programming. Today's webinar will be recorded. During the webinar, you may submit a question at any time using the Q&A button at the bottom of your screen. We have staff monitoring the questions in the chat to convey your questions to our presenter and to answer any technical questions that you may have. You can turn on captions by selecting Live Transcript, the button with two C's at the bottom of the screen. We are conducting an evaluation of our dementia education sessions as a part of this project. You should have received an email with a link to the pre-session evaluation questionnaire, which also contains further information about the evaluation. If you did not have a chance to complete the pre-session questionnaire, we ask that you please complete this now using the link provided in the chat. By doing so, you are helping others in your community. Your responses and feedback will be used to show the impact of programs like these and to improve the tools and resources provided to individuals living with dementia and to the people who support them. I now have the pleasure of introducing our speaker for this afternoon's presentation, Ms. Cynthia Walker. Cynthia is a benefits specialist at Empowering and Strengthening Ohio's People, ESOP, an agency that helps adults in all stages of life achieve and maintain financial wellness and housing stability. ESOP is a subsidiary of Benjamin Rose Institute on Aging. Cynthia has been with ESOP for 12 years, providing various services such as being a foreclosure prevention advocate, a financial literacy counselor, and a financial workshop facilitator. In addition, Cynthia is a HUD certified counselor and has served as a certified Ohio Senior Health Insurance Information Program, OSHIP counselor for the past 5 years. She is a graduate from Kent State University with a Bachelor of Business Administration and an associate degree in applied accounting. Please help me and welcome today, Miss Cynthia Walker.
Thank you, Ashley. Good afternoon, everyone. So we're going to go ahead and get started because we have a lot of material to cover here. I am going to share my screen with you at this time. And I hope everyone can see it. And we're going to start off with a basic overview of Medicare. So Medicare is a federal health insurance program for individuals who are 65 years or older or individuals with disability. And there are four main parts. There's Part A, which is the inpatient care, Part B, outpatient services, Part C, Medicare Advantage plans, Part D, prescription drug coverage. So those are the four main parts of Medicare. So the basics of signing up for Medicare Part A and Part B, we're going to look at this. What is it called? So you have your initial enrollment period. You sign up for this when you turn 65. This is called your initial enrollment period. And at this time, you can also sign up for what is called a Medigap policy. What you do is you enroll in Original Medicare Part A and B. And you could stay in Original Medicare Part A and B, but you can also add on Part D, or you can go into a Medicare Advantage plan, which is called Part C. Now, I want to explain something here. For most people, Part A is automatic. If you have your 40 work quarters in, then you just automatically qualify for Part A. Part B and Part D are electives. You have to let Medicare know that you want to participate in these programs because they do have a monthly premium. Now, the thing is with Part B and Part D, if you do not enroll in Part B and Part D during your initial enrollment period, then there are penalties applied if further down the road you should decide that you do need Part B for outpatient services and Part D for prescription medication. Now for Part B, every year that you go without credible coverage for Part B, there will be a 10% penalty towards your monthly premium for Part B. And every month you go without Part D, there will be a 1% penalty towards your monthly premium for Part D. So it's very important that at your initial enrollment, you think carefully, because you may be the type of individual right now that you don't see the doctor often and you don't take any medication and you don't feel the need for Part B and D. But the best way I could explain this to people, we pay homeowners insurance and we pay car insurance just in case. And that's how we have to view Part B and Part D. We have that coverage just in case, because so many times I encounter clients so many times down the road where they need Medicare Part B and Part D, and the cost is so enormous for them that they can't afford it. Okay, so when do you apply for this during your initial enrollment period? You have a 7-month time frame to apply for Medicare. You have 3 months before your birth date. You have the month of your birth date, and then you have 3 months after your birth date to apply for Medicare during your initial enrollment period. Now we have what is called the annual enrollment period. It is an opportunity to enroll in or change your Part C or your Part D plan each year. This is about to occur. Actually, it starts October 15th and it runs through December 7th. So this is the time of year where you want to look at your Medicare Part D plan to see if it still works for you, because formularies change every year. What may be a tier 1, a generic medication this year may not be that in this upcoming year. So you want to review your plan and see if it still works for you. And if it doesn't, then you have the opportunity to pick another plan. And because most Part C, the Medicare Advantage plans, incorporate Part D into it, you also have the opportunity to change up your Medicare Advantage plan at this time. Now, during the annual enrollment, these new plans that you pick will become effective January 1st of the upcoming year. So that's when they will become effective. Now, what's great about the Part C is that it gives you an opportunity to test out a Medicare Advantage plan to see if you like it, because what comes up next is the general enrollment period. And this is to get you enrolled in Medicare Part A and Medicare Part B if you miss your initial enrollment period. So if you miss your initial enrollment period, the only time you can enroll would be January 1st through March 31st. But this also opens up your opportunity to pick another Medicare Advantage plan if the one you previously picked during the annual enrollment, you decide it does not work for you. Then we have some special enrollment conditions for Medicare. So we have original Medicare Part A and B. And what does this mean? This special enrollment is for people who are 65 and over, who, although they are 65, chose to continue to work, and they get health insurance from their employer. Now, practically in every case, your employer is going to have you take your Part A, because if you have your 40 quarters in, it is free to you. But depending on the size of your place of employment and whether their insurance coverage is credible, you can keep your employer's outpatient services and prescription drug plan. You don't necessarily have to enroll into Medicare, especially if it's cheaper, and it has to be credible coverage. And what we mean by credible coverage is that they have to offer you at least what you would get from Medicare or more. So if your employer has credible coverage and you continue to work, you do not have to sign up for Part B or Part D when you turn 65. You can wait until you officially retire. And when you officially retire, then you have 8 months in which you can enroll in Part B and Part D. Okay. So also you can enroll in Part A and Part B if you miss your initial enrollment period or you lose your coverage from your employer. And again, as I said, you have 8 months that you can enroll into this program, into Medicare without penalty. Part C and D, this is for people who meet certain conditions, like if you moved out of your planned service area or you lose a plan you had through your employer. This will generate what we call a special enrollment period, which allows you to go in and select another plan. If you qualify, you can enroll in a Part C or Part D. And you can also do both of these any time of the year, long as you meet these requirements. Medicare Advantage open enrollment. For this is for Part C. So if you enrolled in a Medicare Advantage plan that you no longer want, this will be the time that you could switch back to traditional Medicare. And again, this is January 1st through March 31st. Now, I want to point out something because I know right about now you're getting a lot of information about Medicare Advantage plans and you're getting a lot of information, calls and whatnot over the phone about the perks and everything that they have. And a lot of people want to try out the Medicare Advantage plan, but you have to be careful with this. And the reason you have to be careful, because if you're carrying a Medigap plan, you cannot keep your Medigap plan with Medicare Advantage. And we're going to talk a little bit more about that later. So during this enrollment period, Part C, if you want to go back to traditional Medicare, this is when you'll be able to do it. So let's define the parts of original Medicare, Part A, B, C, and D. So we have Part A, this is original Medicare. You have hospital care, skilled nursing facility care, hospice, and home health care. Okay, then you have your Part B, which includes your doctor's visits, mental health care, outpatient surgery, lab tests, medical equipment, and some preventative services. And then you have your prescription drug plan. Now, this is what we call traditional Medicare. And traditional Medicare is ran by the federal government. Traditional Medicare only covers 80% of your cost. You, as a participant, are responsible for the 20%. And that's where the Medigap plans come in, because they cover that 20% that Medicare does not cover. Now, with Medicare Advantage plan, you get everything Part A and Part B covers, and many plans offer prescription drug plans, or you can get a standalone prescription drug plan, but they also have a lot of perks. They cover vision, they cover dental, they cover hearing, they cover in-home health care, they cover some modifications to your home. They also give you a monetary stipend that you could use in your local grocery store or drugstore to make purchases or buy vitamins and whatnot. And these plans are great. But to me, the big difference between the two, and it depends on the individual, is with traditional Medicare, you could go to any doctor you choose to. If your doctor says that, Cynthia, you need a hip replacement, and I need you to go see this specialist, then I can go. And I have the hip replacement. If I have Medigap, they'll take care of the 20%. If not, I'm responsible for that 20%. However, with the Medicare Advantage, these are HMOs and PPOs. So your doctors, your hospital facilities and whatnot has to be in the plan network. And also with the Medicare Advantage, there are co-pays with the Medicare Advantage plans. All the co-pays are different in these plans. And there are some great plans where the co-pays are very little. But also with the Medicare Advantage, I will say in 99% of the Medicare Advantage plans, you have to get prior authorization for any procedures that, or tests or treatments that your doctor recommends that you have. For instance, if your doctor says you need an MRI, he has to get prior authorization. If your doctor says that you have to have a hip replacement, Cynthia, you have to have a hip replacement. He needs to get the authorization from the provider. And the provider may come back and say, we think Cynthia could use 6 months of therapy. So I would have to go through 6 months of therapy. Then my doctor come back and they'll say that the therapy didn't work for Cynthia. She still needs the hip replacement. Complete hip replacement. They may come back and say, well, we think maybe a rod will solve the issue. So you have a little bit more control with original Medicare as opposed to Medicare Advantage. And like I said, it depends on the individual. If you're not particular about your doctor, if you're not particular about your hospital that you attend, and if you're a relatively healthy person, Medicare Advantage will work for you. But if you're an individual who has a lot of specialists, you really want to think hard, because you might have to give up a specialist to get into a Medicare Advantage plan. Now, when it comes to Alzheimer's disease and dementia, with Medicare Part A, you're going to get basically the same coverage: the hospital care, the skilled nursing facility care, hospice, and home health care. With Medicare Part B, doctors visit, mental health care, outpatient surgery, lab tests, medical equipment, but you also get what is called a care plan. And this is something new to Medicare, where they work with you and your family and they develop a plan for the patient to have, so they could have a fuller life, a holistic approach. So this is something that individuals that are suffering from Alzheimer's disease and dementia would want to look for with their Medicare plan. Then we have the prescription drugs. Now, Part B went up. There was a substantial increase in Medicare Part B last year. It was the biggest hike that they have ever seen. And the reason for that is because there was a new medication that was coming out, Dulohem, and I'm gonna butcher this name. it's called aducanumab. I know I'm butchering it, but this medication, the anticipation for this medication was great. They had got the approval from the FDA, and they were just waiting from the approval from the board of the CMS, which is the Center of Medicare and Medicaid Services. The cost of the medication was predicted to cost around $56,000. When all was said and done, it did not cost that much. It actually cost a little bit less than that. Now, this medication has only been approved through Medicare for those individuals who are participating in a test trial service. that is approved by CMS, the Center for Medicare and Medicaid Services. So it's not a medication that will be distributed amongst everyone who may suffer from this. They have to be in a case study in order to be able to use this medication. So the Medicare Care Plan Services for Part B, what it means, if you're a person with Medicare and you show signs of cognitive impairment during a routine visit, Medicare covers a separate visit for a more thoroughly assessment of the patient's cognitive function, and they will develop a care plan, and they will use what is called a CPT code 99483 to bill for these services. Medicare pays approximately $283, and it depends geographically. It may be adjusted for these services when provided in an office setting. How do you get started? Detecting the cognitive impairment is a requirement element of the Medicare annual wellness visit. So with Medicare, every participant gets an annual wellness visit. And the detection of the cognitive impairment can also be found as part of a routine visit through direct observation with your doctor or by considering information from the patient, family, friends, caregivers, and others. So if you detect some type of cognitive impairment during the Medicare annual wellness visit or other routine visits, then a clinician can perform a more detailed cognitive assessment and care plan. And these care plans, as I said before, are great because it allows the patient to have a fuller life. So a Medicare cognitive assessment, who can offer this? Any clinician can offer it. A physician, whether it's an MD or a DO, nurse practitioner, clinical nurse specialist, physician assistants. Where can it be performed at? Office or outpatient setting, private residence, a care facility, rest home, or via telehealth. What's included in this assessment? It's a detailed history and patient exam, and it usually runs about 50 minutes. It's a face-to-face with the patient and an independent historian who will perform this assessment. What care plan services results from the assessment? Neuropsychotic symptoms, neurocognitive symptoms, functional limitations, then referrals to community resources as needed to share with the patient or the caregiver with the initial education and support that they need to care for that individual. So when it comes to Medicare Advantage in Alzheimer's disease and dementia, you're going to get everything that you got and you would get in Part A and Part B will be covered. Many plans cover prescription drugs, as I said before, but you can get a standalone plan. And many of these plans will cover the dental and the vision. But what you will also have available to you is what are called special need plans. So the Medicare special need plans, what are they? As I said, Medicare Advantage, they operate as HMOs and PPOs. They limit their membership into these special need plans to people with specific diseases or characteristics. And they tailor their benefits and provider choices and drug formularies to best meet the specific needs of the group that they serve. So who can join it? If you have Medicare Part A and Medicare Part B, because you have to have Medicare Part A and B to be enrolled in a Medicare Advantage plan, and you live in the plan service area. Now, this is the thing. I'm from Ohio. We may have a special needs plan that addresses the needs of individuals with Alzheimer's and dementia, but PA may not. Okay, so there are different plans in different parts of the regions, but throughout the country, they have special need plans. You just have to check and go onto the Medicare.gov. And when you go onto that site, and you go to pick your plans with Medicare Advantage, they'll ask you if you need a special needs plan, and then you'll just thoroughly look through them and see who these plans cater to and what they are offering in the special needs plans. You can also join if you meet the plan's eligibility requirements for one of the 3 special need plans types. So, chronic condition special needs plan. This would be the one that an individual who suffers from Alzheimer's or dementia would fall up under. Then you have institutional special needs plans. This is someone who may be in a skilled nursing home or some other type of facility. And then you'll have the dual eligible special needs plans. This plan is for those individuals who are dually eligible for both Medicare and Medicaid. So, original Medicare versus a Medicare Advantage. Medicare Advantage plans are popular, like I said, because of their convenience. They combine coverage on one card. They have a lot of amenities, and you're able to predict your out-of-pocket costs because Medicare Advantage plans do have a cap on what you will have to spend out of pocket. And once you meet that cap in the Medicare Advantage plan, then all costs are paid by the plan provider. So if you're really, really sick, you might want to look at a Medicare Advantage plan. But then you're hampered by the fact that if you have a lot of specialists, finding a plan that they're all included in the network. Some plans cover emergency care when you are out of the country. Original Medicare allows you to go to any doctor or facility that accepts Medicare. And I guess I'll just share this. Normally when I do these, I share about myself. And when I get to this part, because a lot of people asked me what would I do? And it's just me, as I said, it's an individual preference. Here at ESOP, we have a HMO. We're under a HMO. And I am an individual who suffers from rheumatoid arthritis. And my doctor at the Cleveland Clinic, he retired, so I had to find another rheumatologist. And my doctor had referred me to a rheumatologist that was closer to my home, and he was one of the best in the country. But unfortunately, I couldn't go to him because he wasn't in my provider network. So I had to go to someone else. Now, I know it was a mental thing with me. That's just me. But the whole time I was under his care, I just felt like I was getting second best because I couldn't go to who I wanted to go to. And then our provider changed, and the rheumatologist was now a part of our network. So I was able to change over. And when I went for my first visit, I went in the office crying and telling him how I was feeling and how I felt like I was getting subpar care. And he just let me go on. And when I got done, he told me, Cynthia, I have reviewed your chart, and just let me tell you that I would have given you the exact same care. So it's a mental thing. It really is a mental thing for individuals. So for me, I just like to have the choice to go to who I want to go to, but that may not be the case for you. So let's talk about Part D coverage. This is for the prescription drug. So with Part D, you're going to go through 4 phases. You're going to go through the deductible period. if you have a plan that has a deductible, because all Medicare Part D plans do not have a deductible, and the deductible this year is going to be $505. Now, you'll find some plans that have a lower deductible. It may be $350 or it may be $0, but with those plans, you're going to pay a higher premium cost. Okay, but if you have a plan that has a deductible, you have to meet the full cost of your drugs 100%. You have to pay the full cost of your drug 100% until you meet the deductible. Okay, so that's why when the new year starts in January and you go get your prescriptions filled, they're a little bit higher than normal. And then probably in February and March, you'll see a drop. So most people will, once they meet that deductible, they'll be okay. Because overall, most people pretty much take the same tier 1 medication, which we'll talk about tiers in a minute. Then you go to your initial coverage phase. This begins after you meet your deductible, and you pay a copay or a co-insurance, and your plan pays the rest. So let's say you're taking a typical tier 1 medication for high blood pressure, and you go to the pharmacy and you get it filled. And it costs you $3 to refill it. However, the retail cost of that medication may be $60. You're just only paying $3. Now, the next phase, and hopefully most people will stay in that initial coverage period. Actually, most people do stay in the initial coverage period, but some people unfortunately drop down in what is called the coverage gap, also called the donut hole. And this begins when you and your plan pay together a certain amount. We have $4,130, but that's going to go up in 2023 for your covered drugs. This does not include your premium. Okay, and when you fall into the coverage gap, you're going to pay 25% of the retail cost of your medication, and the plan will pay 75%. So when you fall into the donut hole, you're going to start paying more. And this coverage gap here usually affect people who take high cost medication, individuals who are on insulin. Usually fall into the coverage gap, or some other expensive brand name medication, because the generic medication does not work for them. They'll fall into this coverage gap. So they're going to have to pay 25% of the cost of their medication until they drop to the catastrophic phase. And when you fall to the catastrophic phase, this is where you're going to pay the lowest amount for your medication. This begins when you have paid $6,550 for the covered drugs. Does not include your premium. Now, let me be clear. When it says you have paid, they're not talking about you individually out of your pocket. They're talking about what you pay, your portion, your 25%, and the 75% that the plan pays. That's what they're talking about when they're talking about paid, this dollar amount. So it's not you paying out of pocket $6,550 or $4,130. It's the retail cost of the medication. Okay, but when you're in the catastrophic phase, you only pay 5%. So this is going to be the lowest cost you're going to pay for your medication. Your plan pays 15% and Medicare pays 80%. Now, the good thing about this is I think in 2024, you're not going to have to pay anything if you fall into the catastrophic phase. It'll be 0% for you. The plan and Medicare will pay for that. So these are the 3 phases you'll go through. You'll start off with the deductible period, and that's if you have a deductible. Then you'll go into the initial coverage period. Hopefully you'll stay in the initial coverage period. Most people do, because most people take tier 1 and tier 2 medication. But if you are taking a high cost medication and you fall into the coverage gap, this is when you're going to start paying 25% of the cost of your medication until you get into the catastrophic phase and come out of what was previously called the donut hole and pay the lowest cost for your medication. So the tiers. We have tier 1. This is the preferred generic medications, and these are commonly prescribed generic drugs. For most plans, you'll pay $1 to $3 for drugs in this tier. High blood pressure medication, omeprazole, let me think, Tylenol, naproxen, they fall into this category right here. Then you have tier 2. This is a generic medication, but it costs a little more than your tier 1 medication. Then you have your tier 3 medication, which is a preferred brand. These are brand name drugs that don't have a generic equivalent, and they're the lowest cost brand name drugs on the drug list. And some people, there's in some cases that the generic for some reason does not work for an individual. It doesn't give the results that the doctor is looking for in the patient that the preferred brand offers. So they have to take the preferred brand. And then you have the non-preferred brand. These are higher price brand names and generic drugs that are not in the preferred tier. And then tier 5 are specialty drugs. These are the most expensive drugs on the drug list. Specialty drugs are used to treat complex conditions like cancer and multiple sclerosis, and they can be generic or they can be brand name. So we have these 5 tiers of medication, and the higher the tier, the higher the cost. Now, there is the possibility that the medication that you are taking will not be covered through Medicare. It's going to be a non-covered prescription drug medication. And if that's the case, the plan is going to tell you you have to pay the full retail cost for the medication. But all is not lost, because you can have your doctor submit what is called an exception to the provider. He basically has to explain to them that he has tried other medications, but the medications are not giving the results that they desire in your case, and he's asking the plan to make an exception to allow this medication to be in the plan for you. Now, the plan makes the final decision. They're the ones who say yes or no. And in most cases, they are going to say yes and allow this drug. Now, you have to reapply for this exception every year if it continues to be a non-covered drug. Just because you got an exception for 2022 does not mean you don't have to apply for that exception in 2023. So every year you would have to have your doctor apply for that exception if the medication remains uncovered. You can also have your doctor submit an exception for a tier change. Let's say the medication that he is giving you may be a tier 4 medication, and it's a little expensive. He can write an exception to the provider and see if they will lower the tier of that medication for you to cut the cost. So those are 2 types of exceptions that you could do for Medicare Part D. If a medication is not covered, or if the medication is such a high tier that it becomes too expensive, to have it lowered, have the tier lowered for you. So, questions to ask yourself concerning Medicare Part D. Does the plan cover all the medications that you take? Now, number one, every year we should be looking at our Medicare Part D plan. Medicare Part A, Medicare Part B, There are rarely any changes to them. But Medicare Part D changes every year. Every year they go in and they re-examine their formulary and they move the medications around. They raise a tier, lower tier. So you should go in to see if this plan is still working for you or if there's a better plan for you. And the first thing you want to do is make sure that all the medication that you're taking is covered. And what I also suggest at this time of year for those individuals who are on Medicare is to make an appointment with your doctor to see if he's going to make any changes for your to your medication, because you can only pick a plan based on the current medication that you're taking. So if something changes in the future, it may throw everything out of whack. So this is the time of year to go to your doctor, get examined and whatnot, and see if there's going to be any changes to your medication. Does the plan have restrictions on my medication, such as prior authorization, a step therapy, or quantity limits? So some medication do require prior authorization before you can get it filled. A step therapy is that it goes in step. You'll try this medication first, and then you'll step up to this one and so forth. But quantity limits, there are some medications that you could get like only every 30 days. I have a medication that I take that can only be refilled every 30 days. And I remember being in a situation where I needed to take my medication, but 30 days hadn't passed. So I couldn't take it. I couldn't stay on my schedule until the 30 days had passed for the refill. How much I will pay for the monthly premium and the annual deductible. Now, this gets tricky. A lot of people get caught up with the monthly premium costs. What we have seen started last year, especially with ARP. ARP has eliminated the deductible. They don't have a deductible. But in exchange for eliminating that deductible, their monthly premium were running $88 to $99. So people saw that amount for the monthly premium and they automatically wanted out of the plan. In some cases, that was the right thing to do, but in a lot of cases, it wasn't, because what you really need to look at is what is your total out-of-pocket cost for the year. So if your total out-of-pocket cost for the year is, let's say, $1,000 with ARP, but you go to a plan, you find a plan that has a monthly premium of, let's say, $12, but your total out-of-pocket cost for the year for that plan is $1,500, which one actually is the better plan? So you want to look and see what your total out-of-pocket cost is. Yes, I know $99 coming out of Social Security check is a lot, but if you're getting all your medication for free in that plan, as opposed to paying a lesser premium and you're paying for your medication in the other plan, which one is actually better? So I advise to look at your total out-of-pocket cost for the year. What is the cost of your medication in this plan? Plus, what is the cost of your monthly premium? Is there a deductible? How much will I pay at the pharmacy for each drug that I take? These plans are designed, I'll put it this way, the plans have made contract with the pharmacies. So if you see a plan that says ARP Walgreens RX, then Walgreens is the preferred pharmacy, and Walgreens is going for the pharmacy where you're going to get your medication at its lowest cost. Now, you could be a CVS person and you can continue to go to CVS, but expect to pay more for your medication. So each plan has what they call their preferred pharmacy, and then they have standard pharmacies. The preferred pharmacies are the ones that they have contracts with. The standard pharmacies are all the other pharmacies, and then you have what are called out-of-network pharmacies, which you completely want to stay away from. And then there's mail order. that you can also participate in, which goes to the next question. Is my pharmacy in the plan's preferred network? So we could just skip over that. Can I fill my prescriptions by mail order? All the plans do have the option for mail order. Are my medications brand name or generic? So you would want to know that. Are your medications brand name or generic? And if you were to go to Medicare.gov site, and it's open now, they have a preview of the plans. You don't have to sign in. You could just go in and just preview the plans, and you could put your medication in there. And usually when you put your medication in there, if there's a generic option for it, they're going to bring that up and let you know that there's a generic option for your plan. So if you get an opportunity, go on Medicare.gov and just play around with it and look at the plans and see which ones might work for you. Questions you want to ask yourself concerning a Medicare Advantage plan. How much are the premiums, deductibles, and copays? As I said, some of these plans have great copays. There are some that to go see your primary care physician, there is no copay. And to see a specialist is only $25. So there are some great Medicare Advantage plans out there. What is the annual maximum out-of-pocket cost? They will tell you what your annual maximum out-of-pocket cost will be for that particular plan. So once you reach that maximum, the plan will take care of the rest of your remaining costs for the year. What service area does the plan cover? So one of the first things they ask for when you go on the Medicare.gov site is your zip code. You put in your zip code and they're only going to bring up plans that are covered in that region, in your region, and the zip code that you put in there. Are my doctors and hospitals in the plan network? This is where you have to do your homework. So this is where you're going to have to go to the plan site and you're going to have to look up in their network and see if your doctor and your hospital is a part of that plan network. So you want to make sure, especially if you're particular about your doctors and you don't want to lose your doctors, or you're particular about your hospital, you definitely want to go to the plan's website and check and make sure that your doctor and hospitals are a part of the plan. And if they're not, then you continue your search. What are the rules I must follow to access healthcare services and my medication? It's just the general rules of Medicare. You have to get authorization on these Medicare Advantage plans. I haven't come across a plan yet for Medicare Advantage where prior authorization was not required. And some of them do have limits on what they're going to cover. For instance, how do I put this? If you're thinking about switching over to a Medicare Advantage plan because you went to your dentist and your dentist said that you're going to need a root canal. Okay, so you want a Medicare Advantage plan because it has dental coverage, and you find a Medicare plan that says that it has dental coverage. You need to find out what that coverage is, because in most of these plans with the dental, they're talking about a cleaning, they're talking about x-rays, they're talking about fillings. They're not necessarily talking about root canals. And if they're talking about, if they do allow root canals, how much are they going to pay towards that? That's what you want to find out. Okay. Does my plan cover additional healthcare benefits that are not covered by original Medicare? Yes, most of these Medicare Advantage plans do provide additional healthcare benefits that are not covered by original Medicare, which we just discussed: hearing, vision, dental, and so forth. Will this plan affect any other coverage that I may have? You cannot have any type of secondary coverage with Medicare Advantage. So protection against Medicare fraud. You want to be careful this time of year because there, are a lot of people. You're getting a lot of phone calls, getting a lot of mail. I had a client who recently called me because she received a phone call from someone pitching their Medicare Advantage plan. And she decided to go with it. It just so happened she was 86 years old, but she never had Medicare Part B. And in order to have a Medicare Advantage plan, you have to have A and B. She didn't know that. They didn't bother to ask her. They switched her over. She got a notice from Social Security that her monthly Part B premium, because of the penalties, was going to be $458. So you want to be careful when you're talking with these people on the phone. Make sure you have all the facts and all the information. They will come to your door. They'll offer you cash gifts and whatnot. Anybody who is using high pressure tactics, that should send up a red flag. Or misrepresenting or giving incomplete information, that should be a red flag. And you can always call Pro Seniors, Ohio Senior Medicare, and I think they may have something like this throughout the country, but we have this 1-800 number, 1-800-488-6770, and they respond to reported fraud, waste, and abuse when it comes to Medicare. So now we want to open it up to any questions.
All right, so thank you, Ms. Walker, for such an informative presentation.
It's a lot.
Yes, you did review quite a bit of information, but you did such a good job of breaking it down for us all to understand who don't deal with it day in and day out. As Cynthia mentioned, we do have time for a few questions, so make sure that you are submitting those questions in the question box in the control panel on the right-hand side of your screen. And just as a reminder, if you have questions that are specific to your individual situation, Cynthia has provided her contact information where you can contact her directly. So her phone number is 216-373-1650, or you can send her an email at cwalker, WALKER, @benrose.org. So now let's go to a few of the questions that were submitted. So the first one is just a clarification. They were wondering if you said that there was a 10% yearly penalty. Oh, sorry. Did you say that Part B is 10% yearly? Oh, it is a penalty. Yeah.
Yes.
Okay.
Yes, it's a 10% penalty for every year you go without Part B.
Okay.
And it's a 1% penalty for every month you go without Part D.
Okay. And also, is there a difference between the Med Sup plan and the Med Gap plan?
No, they're the same thing. The Medigap and the Medicare supplement plan is the same thing. And again, just a little bit on that. If you're going to do the Medigap plan, the best time to do it is during your initial enrollment period, because you have what is called a guaranteed issue, which means that they cannot hold any pre-existing conditions against you. And they have to charge you with the negotiated prices that they have negotiated with Medicare for those Medigap plans. Now, if you don't get it during your initial enrollment period and you decide to get it later, you open yourself up to a health screening. So when you go through that health screening, they're going to ask you a series of health questions. My best advice to any individual who's in that situation, it's a yes or no answer. Either your doctor has diagnosed you with something or he has not. The one thing you don't want to say, well, my doctor said if I don't watch my eating, I might have to take high blood pressure. You might as well have just told them you had high blood pressure, because they're going to mark yes. So if you want to do the Medigap or Medi-Supplement, do it during the initial enrollment period, and you'll be good to go.
Okay, thank you for that additional information. Okay, so before we conclude today, Project Director Branka Permetica is going to tell you briefly about BRI Care Consultation. It's a care coaching program available for families impacted by dementia in various counties in Ohio through the Administration for Community Living Project. Branka?
Thank you so much, Ashley. I'm going to go ahead and share my screen, but Cynthia, could you please stop sharing
Yes.
your screen then? I can. Okay, great. It's giving me a little notification here. And now I will share it. Okay. Okay. So as I actually had said, I'm going to talk a little bit about a program called BRI Care Consultation that may offer all of you some additional support. Of course, connecting you with Cynthia Walker. We have her information in the chat box. But this program goes beyond kind of that Medicare support. It provides ongoing coaching and assistance to caregivers who are caring for older adults with or at risk for dementia, including individuals with intellectual and developmental disabilities. And thankfully, from the funding through the Administration on Community Living, this program is provided at no cost to individuals and families. So when you contact, and I'll show you how you can access this program, each individual or family is assigned a personal care consultant that helps with identifying the specific issues that are going on. And a lot of times it's about finding and connecting with health and community services, just really trying to get to know what's out there and what's available and what's appropriate. Also prioritizing these concerns by designing what we call action steps. And really it's a step-by-step plan. It's kind of a really great list that can just kind of check off, and it's personalized and it's really based on individual needs. It helps with communicating with other family and friends about the care and how to manage some maybe difficult situations and behaviors, staying in touch and making adjustments as the care situation changes. So as I said, it's not just a one-time phone call. Individuals and families stay connected so those adjustments can be made. Care consultants really try to involve other family and friends to help in different aspects of care. So how to ask for help, how to, identify different things that other family and friends can do, even if it's delivering a meal or staying with your loved one for some time while you go out and run an errand. And mostly, it really provides that great emotional support for caregivers when sometimes feeling overwhelmed with challenges and really understanding their situation. So how do you access this program? Well, here we have in the project counties for our ACL project, Cuyahoga, Lake Geauga, Lorraine, Medina. You can access this program through the Benjamin Rose Institute on Aging. And the BRI Care Consultation program is called We Care Because You Do, and you have that number there. Welcome House provides a program as well, but focuses on individuals with intellectual and developmental disabilities. Then we have 2 areas in Southwest Ohio and part of West Virginia through O'Neill Center, United Seniors of Athens County as well, that provide the program for both older adults and individuals with intellectual and developmental disabilities. So like we said, you can access this information from our webpage, and this information will be sent to you so you can have those phone numbers. And back to you, Ashley.
Thank you, Branka.
Mhm.
So we want to thank Ms. Walker again for such an in-depth and informative presentation. And thank you to all of you for joining us. I know that there were some questions in the chat that we weren't able to get to. So we will get your email addresses and reach out to you directly with those answers. And again, if you did have those individualized questions, make sure that you do reach out to Cynthia directly. And then we also put the contact information in there for ESOP. So thank you for joining us today for the basics of Medicare benefits. A recording of today's session will be made available at www.benrose.org on the event registration page and in our resource library. And as we've mentioned, you will also receive a copy of the slides, and those will be emailed to you. We are offering more webinars like this for community organizations and families that have been impacted by dementia each quarter of this ACL project. We hope that you will join us for our upcoming webinar. It's going to be on October 27th. It is end-of-life decisions for individuals with IDD, intellectual and developmental disabilities and dementia. To stay up to date about our upcoming programs, please visit our website. Again, it's www.benrose.org. In the chat, you will see a link to the post-session questionnaire. You will also be receiving it by email later today. We ask that you just please complete the post-session questionnaire within 1 week following today's session. Your responses and feedback will be used to show the impact of programs like these and to improve the tools and resources provided to individuals living with dementia and to the people who support them. Thank you again for joining us, and we hope that you have a great rest of your day.